Today on PlacidWay Pulse, we're comparing Mexico and Turkey for dental and cosmetic travel, including dental implants, crowns, hair transplants, rhinoplasty, facelifts, mommy makeovers, and other treatments patients often research abroad.
Right, and it is such a massive topic with so many moving parts, you know?
It really is. And before we get completely lost in the weeds here, I need to say this right up front. This episode is for educational purposes only. It is not medical advice, diagnosis, or a treatment recommendation. Anyone considering dental care, cosmetic surgery, or treatment abroad should speak with qualified healthcare professionals, review their medical history, and ask detailed questions before choosing a provider.
Exactly. Super important context before we get into the heavy logistics.
Yeah, absolutely. Because, when we usually do a deep dive into international healthcare, people, well, they instantly default to the price tag.
Oh, always. It's the first thing everyone types into the search bar.
Right. But today, we're doing a deep dive into the physical reality of this, like the biology, the actual logistics, and honestly, the emotional weight of getting on a plane for a major medical procedure.
Because it is a huge physical toll, right? I mean, picture yourself in seat 14B on a long-haul flight. You're exhausted. Your face might be wrapped in compression bandages, and the cabin pressure is it's making everything throb.
Ugh, yeah, that sounds incredibly intense.
It is, and you still have, 9 hours of ocean to cross. So many people face that exact scenario because they only looked at the glossy before and after photos, you know? They totally forgot to factor in the physics of the flight home.
That paints a really vivid picture. To really ground this, I want to introduce you to Daniel.
Okay, Daniel.
Yeah, Daniel is a fictional patient, but he essentially represents thousands of real people going through this right now. He's from North America, let's say the Midwest, and he starts his search because he needs dental implants.
Right, which is a really common starting point. Usually starts with a functional need.
Exactly. He's tired of the pain when he eats. He's hiding his smile. But as he's researching, he falls down the rabbit hole.
They always do. You start looking at teeth, and suddenly you're looking at hair transplants, right?
Yes. He starts looking into hair transplants, maybe some facial cosmetic stuff. He realizes this trip could be like a total reset for his confidence.
And I'm guessing 2 countries keep popping up on his screen.
You guessed it. Mexico and Turkey. And they are completely different paradigms. Like, Mexico feels close. The time zones are familiar. It feels manageable for a guy from the Midwest.
Yeah, whereas Turkey pitches itself as this massive, all-inclusive medical hub.
Right. He's seeing, 3D clinic tours, VIP hotel transfers, translators, the whole package.
So Daniel is suddenly pivoting. He's not just asking about affordability anymore. He's asking deep human questions.
Yeah, he's asking, where will I actually feel safe? Or, when I wake up from anesthesia, who is going to explain things so I understand them?
What if I need follow-up? That's a huge one.
Exactly. How far am I willing to travel while my body is actively healing? Because, honestly, you're not just choosing a country. You're choosing who you trust with your smile, face, hair, or body.
What's fascinating here is how that profound emotional reality intersects with the rigorous practical logistics of a medical journey.
Oh, for sure. Because once you make that choice, you are locked into a highly structured pipeline.
Yes. Whether it's a boutique clinic in Tijuana or a massive hospital in Istanbul, you are going to go through 5 distinct phases of travel.
Let's unpack this, because I think a lot of people approach medical travel with, a vacation mindset. They think it's booking a resort.
Oh, it is not a vacation. Not at all.
Right. It's more like planning a wedding while preparing for a marathon. So let's talk about phase 1, before travel.
Phase 1 is intense. Daniel isn't just picking a date on a calendar. He has to gather all his medical records. And for dental implants, he can't just send over a regular flat X-ray.
It's too basic, right?
Exactly. He needs to send the 3D CBCT scan. It stands for Cone Beam Computed Tomography.
Okay, wait. Why is that specific 3D scan so vital?
Well, a flat X-ray doesn't show bone density or width. When a surgeon is drilling a titanium post into your jaw, they need 3D data so they don't hit things like the sinus cavities or major nerves.
Wow, okay. So he has to figure out how to send these massive digital files internationally before he even buys a plane ticket.
Yes. He has to medically qualify first. Then we hit phase 2, which is arrival. And this is where the reality really hits you.
Oh, I bet. The anxiety of stepping off a plane, you're in a new climate, maybe sleep-deprived, and you know surgery's tomorrow.
It's a very vulnerable moment, and Turkey and Mexico handle this arrival phase completely differently.
Let's talk about Turkey first.
Turkey is like a closed-loop system. When you land in Istanbul, you are not hailing a cab. A coordinator is waiting for you with a sign, speaking perfect English.
So they just whisk you away.
Pretty much. They put you in a luxury VIP van and take you straight to a partnered 5-star hotel. It's this frictionless bubble. You just follow the itinerary.
Okay, so Turkey is this highly curated walled garden, kind of like an all-inclusive resort for surgery. How does Mexico compare?
Mexico is more modular. It leans heavily into geographic proximity. For Daniel, it might just be a short flight, or even a drive across the border to somewhere like Los Algodones.
So it's less of a bubble, but maybe more familiar.
Exactly. The clinics have bilingual staff who are super used to North American standards. The friction is lower just because the travel time is so short and you have a bit more autonomy.
Got it. Which brings us to phase 3, treatment days. The actual surgery and waking up from the anesthesia.
And that cognitive fog after anesthesia makes phase 4, the recovery phase, the most misunderstood part of the whole thing.
Because people think recovery means sitting by a pool with a cocktail.
I wish.
Yeah.
No, your body is dealing with major surgical trauma. You have swelling, you're on a restricted diet, you can barely move around your hotel room, and you have to go to mandatory clinic follow-ups.
And even when you finally get cleared to fly, phase 5 kicks in, the return home. And it doesn't end just because you're back in the Midwest.
Not at all. You're dealing with remote aftercare via WhatsApp. You have to know what to do if you spike a fever or if something just feels wrong.
Yeah, that's not a small decision.
No, it's a massive commitment. And the specific logistics change wildly depending on what Daniel actually decides to get done.
Let's focus on the dental stuff first. Rebuilding a smile.
Yeah.
Why are dental implants kind of the center of this conversation?
Well, we have to strip away the marketing jargon. A dental implant isn't actually a tooth, it's a 3-part mechanical system.
Okay, break that down for me.
The foundation is the implant post. It's a tiny screw, usually titanium, that the surgeon literally drills into your jawbone to act as the new root.
And your body is just totally cool with a piece of metal in the jaw.
That's the biological magic of titanium. The body doesn't see it as a foreign object. So this process called osseointegration kicks in.
Osseointegration. That sounds complicated.
It basically means your living bone cells crawl onto the threads of that metal screw and weave themselves into it, fusing it solid.
Oh, wow. But I'm guessing that takes time. It doesn't happen over a weekend.
Right. It takes 3 to 6 months. If they put the heavy permanent crown on right away, the force of you chewing would just tear all those delicate new bone cells apart. The implant would totally fail.
Ah, so that means dental implants usually require 2 completely separate trips.
Exactly. Trip 1 is placing the root. You fly home, wait for it to heal, and then trip 2 is coming back months later to put on the abutment, the connector, and the actual visible tooth.
And this is where Mexico has a massive advantage for someone like Daniel.
Oh, huge.
Because if you have to wait 3 to 6 months and fly back, a 3-hour flight down to Mexico is easy. It absorbs that logistical headache.
Precisely. But what if Daniel doesn't need the roots replaced? What if he just needs the visible part of the teeth fixed?
You mean like dental crowns?
Yes. Crowns are a totally different biological timeline. You don't need to wait for bone to heal. The timeline shrinks, but the need for advanced technology shoots up.
Because they have to shape the teeth and fit them perfectly.
Right. Yeah, they shave the natural teeth into little pegs. Then, instead of those awful gooey putty molds, they use a 3D intraoral scanner to map the mouth.
I've heard a lot about zirconia for these. Why is that the go-to material?
Zirconia is super dense and durable, and they don't pour it into a mold. An in-house lab uses a CAD/CAM machine, like a 3D robotic router, to literally carve the teeth out of a solid block.
Oh, that is so cool. It's like subtractive manufacturing.
Exactly. But the final fitting is where it gets tricky. The way your upper and lower teeth meet is called occlusion, and it is sensitive down to the micron.
Meaning if it's even slightly off, it's a big problem.
Huge problem. If a crown is a fraction a millimeter too high, every time you bite, you hit that spot first. It causes severe pain, even TMJ. So the dentist has to make these microscopic bite adjustments before they glue them in for good.
Okay, so this whole crown process, the scanning, the milling, the adjustments, can that be done in one trip?
Yes, usually in about 5 to 7 days. And this is why Turkey is so competitive for crowns and full mouth restorations.
Because they can bundle all that advanced tech into one big trip.
Right. They bundle the 3D scans, the in-house milling, the luxury hotel, everything into this one highly orchestrated event.
But let's play out a scenario here. Let's say Daniel gets his crowns in Turkey. He flies back home to the Midwest. 2 weeks go by, the swelling goes down, and he realizes his bite is just slightly off, like that fraction of a millimeter you mentioned.
That is the pivotal variable of medical travel. Complications don't respect borders.
Right. If you went to Mexico, flying down for a 20-minute bite adjustment on a Friday is annoying, but it's totally doable.
But if you went to Turkey,
Yeah, if you went to Turkey, getting that exact same 20-minute adjustment requires a 14-hour international flight back to Istanbul.
which perfectly illustrates why neither country is universally the best. Mexico is deeply practical for multi-stage work. Turkey is amazing for massive single-trip transformations, as long as you can handle the distance.
Follow-up sounds boring until you actually need it.
It really does. And if we connect this to the bigger picture, distance isn't just about the annoyance of a follow-up visit. When we move to body and facial surgeries, distance is a critical physical factor.
Let's shift to that because Daniel's looking at hair transplants now too. And, our listeners might be researching rhinoplasty, a facelift, or a mommy makeover.
These are major medical interventions. We have to talk about how the biology of recovery interacts with the actual physics of flying.
Let's start with the hair transplant because, honestly, it seems pretty simple on the surface.
It seems simple, but it is actually an exercise in microscopic vascularization.
Vascularization, meaning blood flow.
Yes. They extract individual hair follicles from the back of your head, and those follicles are basically living microorgans.
Wait, microorgans?
Yeah. They've been severed from their blood supply. When the surgeon implants them into the top of the head, they have to establish new microcapillaries to survive.
So the recovery is really just about keeping those tiny grafts alive.
Exactly. For the first week, nothing anchors them but tiny scabs. If Daniel bumps his head on a car door, he will literally knock the grafts out and ruin the surgery.
Oh my gosh, that sounds incredibly stressful.
He has to sleep at a 45-degree angle on his back, sometimes with a neck pillow, so nothing touches the grafts.
Imagine trying to navigate a crowded airport terminal, protecting thousands of unanchored microorgans on your head.
It's a high-risk obstacle course, and if you elevate that trauma to facial surgeries like a rhinoplasty, it gets harder.
Because with a rhinoplasty, they're breaking bones, right?
Yes, osteotomies. They reshape the bone and cartilage. The inside of your nose gets incredibly swollen.
And what about a facelift? That seems even more intense.
A modern D-plane facelift is architecturally invasive. They go beneath the SMAS layer, the muscle layer of the face, to reposition the whole structure.
Wow, so it's not just pulling the skin tight.
No, not at all. And the body's response is to rush fluid to the area. You get severe swelling. And for older patients, managing blood pressure is critical. If your blood pressure spikes, a freshly cauterized vessel could burst.
Let's push this to the absolute extreme. The mommy makeover.
Arguably the most physically demanding procedure out there, because it's actually multiple major surgeries combined into one.
Right, it's usually a tummy tuck, breast surgery, and liposuction all at once.
Let's look just at the tummy tuck. People think it's just removing fat, but it's structural reconstruction. Pregnancy often separates the core muscles. It's called diastasis recti.
So they have to literally stitch the abdominal muscles back together.
Yes, which means your core strength is completely gone for weeks. Think about how you get out of bed.
Use your core.
How do you sit up in a chair? Core. After a mommy makeover, you cannot sit up unassisted without risking tearing those internal stitches. You walk hunched over because the skin is so tight.
And with liposuction, you have all that fluid swelling too. So if you think about it, you absolutely need a travel companion. You couldn't even reach the overhead bin for your luggage.
It is a fundamental safety requirement.
Yeah.
You need help just navigating the hotel bathroom.
So take all of that biological trauma, the fragile hair grafts, the facial swelling, the stitched up core, and put that recovering body inside a metal tube flying at 35,000 feet. What happens?
You run into the brutal physics of aviation. First, there's DVT, deep vein thrombosis.
Blood clots.
Exactly. Surgery makes your blood clot faster to stop bleeding. Add in sitting perfectly still in a cramped airplane seat for 12 hours, and blood pools in your legs. If a clot breaks loose and hits your lungs, it's fatal.
That is terrifying. But there's also the issue with the cabin pressure itself, right?
Yes, Boyle's Law. An airplane cabin is pressurized to feel like you're at an altitude of maybe 8,000 feet.
So the air pressure is a lot lower than on the ground.
Right. And when outside pressure drops, the fluids and gases trapped inside your body physically expand.
Oh, no.
Right.
So if you have pooling fluid in your face from a rhinoplasty or in your stomach from a mommy makeover.
The cabin pressure literally forces that fluid to expand. It stretches your skin, pulls on your fresh stitches, and spikes your pain levels. It is the worst possible environment for fresh surgical wounds.
A long flight feels different after treatment. A 14-hour flight normally is just watching movies.
Mhm.
A 14-hour flight while wearing compression garments and guarding a fresh hairline. Completely different universe.
Which is exactly why Turkey has adapted its protocols. Because that flight back to North America is so long, Turkish clinics usually mandate that you stay in country for 10 to 14 days minimum.
Ah, so that 5-star luxury hotel in the package isn't just them being fancy. It's a physiological holding zone.
You nailed it. They keep you grounded during the highest risk window for clots and swelling. You get nursing care and lymphatic massages while you wait out the danger zone.
Now, contrast that with Mexico for a North American patient.
Mexico offers a flight that might only be 4 to 6 hours, so the DVT risk plummets, and you aren't exposed to the cabin pressure for nearly as long.
Plus the time zones.
Yes, circadian rhythms are huge. Flying from Turkey to the U.S. induces massive jet lag, which completely disrupts your immune system and your cortisol.
Right, your body heals better when it actually knows what time it is.
Exactly. Recovering in a familiar time zone supports your natural healing cadence.
Let's bring the focus right back to Daniel. He understands the phases, the dental mechanics, the recovery risks, the flying physics, but now he's just sitting at his laptop staring at quotes from clinics.
Yeah, the dreaded package quotes.
How does he actually compare them?
This is where Daniel has to dismantle the whole concept of the package.
Yeah.
The most critical rule is to look at total value, not just the bolded price at the bottom of the PDF.
Right, let's slow this down and make it easier to compare. What is he actually looking for?
He needs to verify the specific surgeon's experience, not just the clinic's brand name. He needs to demand a line item breakdown. What does follow-up look like? What is the protocol if there's a complication?
And Turkey is famous for that all-inclusive model, right? Like surgery, hospital fees, hotel, transport, coordinator, all wrapped up.
Yes, it completely outsources the logistical stress. You surrender control, but they manage every single variable.
But Mexico's approach is different. They focus heavily on medical excellence, combined with logistical convenience, like high English proficiency and the ability to easily fly back for stage 2.
Exactly. In Mexico, you might book your own boutique hotel, but you gain incredible flexibility, which again proves there is no universally perfect country. It's about aligning the destination with the patient's specific needs.
So Mexico aligns with the patient who wants geographic proximity, shorter flights, and is maybe doing multi-stage dental work where they have to return.
And Turkey aligns with the patient who can handle long-haul flights and wants a heavily curated concierge-level experience for a complex single-trip transformation.
But Daniel has to read the fine print. Pretty package prices are not enough. Patients need to know what's included.
Absolutely. If the quote says dental implants, does that include the titanium post, the abutment, the permanent zirconia crown? Are the 3D scans billed separately?
And what if the treatment plan changes once you get there?
That is the ultimate stress test. Say Daniel gets there, they do a 3D scan, and realize he needs a bone graft before the implant.
Ooh, that changes the whole timeline.
Yes. Does the fixed package price adapt? Do they cover the extra hotel days? A reputable clinic will have a clear, transparent answer for biological surprises.
And that scenario is exactly why bringing this back to Daniel is so important. He realized this isn't just about saving money. It's about his psychological comfort, his travel tolerance, and matching his needs to the right clinic.
It really is a deeply personal alignment.
For Daniel, and really for anyone listening, the emotional core of this journey is about feeling understood, feeling safe, and feeling supported from the first email to the final healed result.
But protecting that emotional core requires mastering the practical core. Verifying credentials, understanding every line item, and planning for the sheer physical demands of the distance you're traveling.
You have a really great way of looking at those before and after photos, too.
Yeah, I'd like to leave you with this final thought. When you are looking at those flawless, glossy before and after photos, don't just look at the final results. Ask yourself, what did those days in between look like for that patient?
The in-between days.
Right. When they woke up swollen and disoriented, who was holding their hand? How did they manage the cabin pressure on the flight home? And what kind of support did they have when they finally walked through their own front door, healing an ocean away from their surgeon?
If this topic connects with what you are exploring, you can use PlacidWay to compare dental and cosmetic travel options in Mexico and Turkey, ask questions, and request a free quote when you are ready.